Welcome back to our Medicare Educational Series, Part 4. Today we're going to be talking about Medicare Advantage, aka Part C of Medicare. So, for those who may not know, Part C Medicare Advantage plans are actually an alternative to Original Medicare, which we covered earlier. Original Medicare is Part A, Part B, a Medicare Supplement plan, and Part D. Medicare Advantage plans actually combine all of those services really into one package. So you're going to continue to pay Part B premiums, but Medicare Advantage plans usually have a $0 premium. They're paid by the federal government to manage your Part A and Part B coverage privately. So what actually happens is that the federal government pays a monthly stipend to these private insurance companies to implement all of your care. There is no coordination with Part A and Part B in the supplement plan like we described earlier in original Medicare. The private insurance company gives you an all-in-one package, and they are responsible for implementing that coverage and being the facilitator of that coverage for you. So what does it cover? The plans follow a pay-as-you-go type of system with, maximum out-of-pocket guidelines, meaning that you're going to pay a copay for every single service that you receive. When you go to see your doctor, there's a copay. When you have an outpatient procedure, there's a copay. If you go to the hospital, there's typically a larger copay. And they all can add up to go against a maximum out of pocket, which can be, $8,000, $9,000 or more, whatever the federal government sets as the highest limit for those plans. There's also some state laws that go into that as well. So typically you're going to pay a copay for primary care or specialist, inpatient services, those kind of things. It's going to follow the Part D structures pretty closely. There are some alternatives there where they might lower the deductible and things like that. That's just all how it might come out in the wash as far as the benefits of that particular Medicare Advantage plan that you're looking at. Medicare Advantage plans have a lot of additional benefits, and they can be very, very attractive for someone who is shopping for them. You've probably seen them on TV. There's usually big name celebrities that are advertising for them, like Joe Namath, just to name one. There's a couple others as well, but they're going to put together a nice package of benefits for you, including your routine vision exams, foot and ankle care, hearing exams. Sometimes they include gym memberships. There could be like a 24/7 nurse line that you can get a hold of. Sometimes they'll offer transportation services for folks who might have a hard time getting to doctor's appointments. They may give you an over-the-counter allowance for certain non-prescription medications, and they'll also cover preventative dental and a few other things as well. It's important that you know that Medicare Advantage plans have networks. So they're going to function probably similar to any type of employer coverage that you've had, where they might be an HMO or a PPO. So an HMO is a health maintenance organization, and that's where basically it's a plan that your primary care physician is the quarterback of your plan. When you choose that primary care provider from the plan network, that PCP provides medical care and will give you referrals and things like that. You will have to get referrals to go to specialists, such as cardiologists or dermatologists, things like that. But you usually receive contracted prices, and it can be a little bit cheaper to go with an HMO. But if you want the freedom to go out of network and really have a little bit more choice in your doctors, you may want to go with a PPO, aka a preferred provider organization. So every PPO has a provider network as well, typically a little bit bigger than the HMOs, and they're going to offer you coverage for out of network care, albeit at a higher rate. So you'll have your in-network providers. They're going to offer you those contracted rates, same as the HMO. However, if you want the flexibility, you can go to a different provider that's out of network, but you might just pay a little bit more. So the main difference between the HMO and the PPO is really how the network is utilized. When you need to see a specialist, to get to see a cardiologist, like we said, you're going to have to go through your primary care physician. Whereas with the PPO, you can simply just make an appointment and go directly if they're in network, or if they bill your coverage. It's important to know which one is best for you, and that's something we can help guide you with. In regards to Part C eligibility, Medicare Advantage eligibility and qualifications, so you are eligible if you are enrolled in Medicare Part A or Part B and permanently reside in the service area of the plan. There are no questions asked, no health considerations taken into account. You can simply choose these plans, and you can actually change them during the annual enrollment period every year that goes from October 15th through December 7th. And then there's also a Medicare Advantage open enrollment period that occurs between January 1st and March 31st of every year. So there's flexibility in changing plans if you get into one that's not quite right for you. Some of the most common times to enroll in a Medicare Advantage plan is during your initial enrollment period. So that's 3 months prior to your birthday month of Medicare eligibility. So 3 months prior to your 65th birthday, the 65th birthday month, and then 3 months after your birthday month. There's also, as I mentioned just a moment ago, the annual enrollment period that goes from October 15th through December 7th every year. That's going to allow you to change that plan, because the reality is these plans do change benefits every year. Sometimes the benefits decrease, sometimes copays go up, and that might warrant a change to a different plan for the following calendar year. Just to expand on that open enrollment period from January 1st through March 31st each year, you can change your Medicare Advantage plan one time, or you can return to original Medicare during this period as well and go into a Medicare supplement plan. There are also special enrollment periods, such as an unexpected life event where you might leave your group plan, group coverage, things like that. There are also times where if you relocate, if you go outside that plan service area and move to a different one, you'll be able to go into a new plan using that special enrollment period. If you go into a nursing home, you can also utilize that special enrollment period. That's a continuous enrollment period to go into a new plan. If you have any questions about Medicare Advantage, don't hesitate to reach out. We'll be able to guide you.